Welcome to CVAMS Island Pulse, the Cape Verdean Health Dialogue Podcast. I'm Lucy Coutinho, a mental health counselor, speaker, and author. Today, I am so pleased to introduce to you all Dr. Texeira, the founder of CVAMS, Cape Verdean American Society, to share his vision behind this mission, its inception, and the work that he has been able to do within the Cabo Verde Islands. Welcome, Mr. Texeira. How are you feeling today?
I'm well, thank you. And thank you for inviting me to be part of this initial new push as a podcast for our society.
Yeah, thank you so much. And thank you for all the work, amazing work that you've been doing for our community. Now, we do want to know, I want to know, what inspired your mission to start CVAMS, and when was that started, and what was the need that you felt you wanted to help the Cape Verdean community?
Okay. So to be truly honest with you, it goes back a long time, So when I was a teenager, and I spent some time at the Fox Point Boys Club in province. There's this guy who was one of our mentors and counselors by the name of Johnny Brito. He was well known in the community. And Johnny would always ask all of us what we wanted to do when we grew up. We were like young teenagers playing soccer and basketball, and kept us out of trouble. And I always told Johnny I wanted to be a doctor. And he was like, and then what are you going to do when you become a doctor? I said, I'm going back to Cabo Verde. He's like, man, you're never going back. I was like, that's what I was like, no, you have no idea. He used to tease me, like, he used to laugh at me. And he thought it was like the funniest thing, the idea that I thought that I would ever go back to Cabo Verde. So I was like, John, I am going back. That's my goal. He's like, no, man, you have no idea what you're talking about. That's why I'm saying it. Once you become a doctor in this society, there's no way you'll ever go back.
Wow.
And I think I was stuck in the back of my mind. And Johnny was right. By the way, I was just an immature young kid. I had no idea what I was saying. Johnny obviously had the wisdom of life to really make that kind of call. And he was right. But I always kept that in the back of my mind. And so, in a way, CVAMS to me was like a way of going back, and giving back. And it's a thought that's been behind in the back of my mind for like 30 years. From when I first graduated from medical school, I got together with a couple of my colleagues who also became very in descent that I knew were also going through medical school at the time. And we got together, it was like 4 or 5 of us. We really didn't have a critical mass to do anything. We're young doctors, young residents. We really didn't have the wherewithal to really push this forward. So, but we did meet, and we talked about it. We had a little meeting, but we clearly realized that we didn't have the bandwidth to really push this at the time. And then we all kind of went our own ways, built our careers, and
Mhm.
then COVID is what really brought us back together.
Wow.
COVID came in, and we all had this sense of urgency about, I was in New York, and New York, one of the first places to really take the big hit of COVID. It was
Yeah.
a scary thing, very scary thing. And in front of my hospital, we had like refrigerated trucks, we're putting bodies into an hourly basis. It's a really scary time in our lives.
Yeah,
And
absolutely.
then I could only think back to Cabo Verde and say, oh my God, when this thing hits there,
Right.
it's going to be a disaster. So we need to organize. We needs to come together and figure out how we're going to help this situation. And that's how we started to meet and started to talk about and started to invite doctors in Cape Verde to participate in meetings. I was like in the epicenter of COVID. So I was sharing with them some of the protocols we were using in terms of caring for patients and the results we're seeing. This is before COVID actually hit there, you
Right.
know. And so this was around March, April of 2020.
Wow.
And as we began to, on Zoom, begin to talk about that, I invited doctors in Cabo Verde to participate. Then it was like, started to get more and more people involved. And then, by May of 2020, 5 years ago at this time, we were talking about building an organization. So
Wow. So how many doctors would you say it started off with initially?
it was like a handful of colleagues that we started talking about the idea, and then everybody knew someone
Hmm.
else.
Right.
And the very interesting thing about our organization is that we have family clusters. You
Oh,
know, we have these families where education is like a priority, and valid education. And so within like these families, you'd have like 4 or 5 doctors, you know?
wow.
And so it's interesting to the once I found one, I would get 4 or 5 more,
Yeah,
So we kind of grew exponentially because we found these clusters of families that were very successful.
that's amazing.
That allowed us to grow.
And all Cabo Verdeans, right?
Yeah, so our organization is primarily made of people of Cape Verdean ascendancy.
Mm-hmm.
Now we do have people who are friends of ours who have joined because they share passion, they share the interest and passion to global health, and they want to give back to low and middle income countries. And so we welcome them. Our organization is not restricted ethnically or culturally, but we do obviously attract people of Calgary ascendancy.
Mm-hmm.
But we are open to other people who want to contribute.
Absolutely. And the mission is to go back to Cabo Verde and do the work there, correct? Is that pretty much what the mission is of the organization, you would say?
Not necessarily. Our mission is sort of broad.
Mm-hmm.
We want to have a number of specific goals. One is to give back to improve the healthcare services in Cabo Verde for sure. The other is to raise awareness about health issues in our diaspora communities. Um, and we within that we also have a mission to do contribute to sponsor and do research into health concerns that exist in our communities.
Mm-hmm.
To look at ways in which we can advocate for uh, for concerns that may exist within our communities. We also have a mission to promote education in the next generations of Cabo Verdeans who want to pursue healthcare careers. So we want to be role models and provide scholarships and opportunities for mentorship
Worship,
for the younger kids who are. So we have a huge uh, student committee, and they are one of the most active parts of our society. They every single day they are trading notes and books and they're sharing tests, they're collaborating with each other globally.
Wow.
Uh, so our student community is very, very active, and it's one of the most vibrant parts of our society.
Wow, that's amazing and really great information to have, right? So we're going on 5 years, right, since its inception. Now, you've seen the growth. What would you, where are we now in terms of the growth from where it started to where we are? What would you say has changed?
So yeah, so we've grown a lot more than we expected to be, you know. So I didn't expect to find 200 members, and now we have 200 members. We're in 27 states across the United States.
Wow.
And we also have now started a Brazilian chapter. So we have Brazilian, Cabo Verdean Brazilian doctors who have joined our society and are participating in it in an active way. So we've started growing with like international chapters. And so that's also been a very exciting part of our growth. And our impact in Cabo Verde has also uh, is something that has gone beyond our expectations. You know, so it's been COVID obviously also limited our ability to return and get back. But as of 2022, with masks in our faces, we did go back to Cape Verde team.
Wow.
We initially like a team of 23 doctors at that time for our first trip, and since then we've done 7 trips to Cabo Verde, and we make sure make a big distinction with the idea that we are not doing mission trips.
Mm,
These are exchanges. These are cultural scientific exchanges. We don't want to have that savior syndrome. We want to go there and collaborate with our colleagues. We want to exchange ideas, bring things that we do here that are good, and we learn from them in some of the things they do, respect what they do, appreciate their impact in the society as well. And I think that way we have a much more long-lasting impact. So we are collaborating shoulder to shoulder.
wow.
Um,
Yeah, I
and
really
so,
love that aspect of the collaboration, like going back and actually working with doctors that are already established there. Um, and so what would you say is the biggest need in terms of going back to Cabo Verde? And I know you're a surgeon, right? Are there a lot of surgeries that are done when you go back, or what are the main concerns?
so yeah, surgery is the easy one. You know, for surgeons, our impact is direct. It's you see it the next day. Yeah, so we leave a immediate impact, and that our medical colleagues in primary care, internal medicine, are really jealous of us in many ways because of that. But what they do is also just as important. Uh, so the needs that we identify are several.
Mhm.
Number one, when we first went, our goal was to is work on how can we improve the quality of education, training, to do information and training transfer from we here working in high income countries with very sophisticated equipment and technology, the latest in terms of training equipment, but to go back and give back some of the more advanced approaches to like minimally invasive surgery and cancer surgery and other things. And but at the same time to train people and so that it's not just the idea of bringing in us doing things and leaving, but for
Mhm.
us to actually leave back skills and equipment and materials. And that exchange in terms of scientific exchange.
Hmm.
And I also call it a cultural exchange because we're also dealing with cultural practices in medicine,
Mm,
that are sometimes different, and that kind of rubs off on them, the things that we do here, learn from us, we learn from them in terms of the humanization of healthcare. So there's a lot of exchange that takes place. But in addition, we've learned that a few things, that some of the things that we can do there are things currently they're not able to do in Cabo Verde. But a lot of patients in Cabo Verde are waiting to be transferred to Portugal to undergo more advanced medicine, advanced
yeah,
care. And often, by the time they arrive in more advanced stage of disease and the outcomes are not very good. So if we can intervene in Cabo Verde at the early stage, we can provide better outcomes for the patients there. And so that's one of the areas that we're focused on is bringing in, more complex surgeries in patients that are waiting for transfer so they don't have to.
right.
And then we've realized also there's another level of transfer, and that's from like the more remote islands into
Right.
the central hospitals. And a lot of those patients are waiting to get transferred. Now, if we can bring more complex surgery and care, medical care to those more remote islands like Brava and San Nicolau and others, we can also have an impact in the healthcare system by preventing for them to naturally having to be transferred into Praia or something for more complex care. So that's another level. So we've realized that in addition to being able to train and provide care in a sophisticated level, we also realize that there's a lack of access to healthcare because
Yeah,
one of the biggest needs that Cabo Verde has is human resources in terms of doctors, psychiatrists, mental health professionals, pediatricians, and so we import Cuban doctors in all these basic specialties to help support the healthcare system because there's a lack of access. So even when our teams are there for 2 weeks,
yeah,
you know, in an island like San Nicolau or Brava, there are patients there who haven't seen a doctor over a year, or we were in Sal a couple of years ago, and there were no pediatricians in Sal at that time. Now there is, but at that time there was no pediatricians. And so those kids, for the first time, were seeing a pediatrician in their lives. So it was great to have those pediatricians go there because they
yeah.
provided care and education to these kids. And Cabo Verde does very well in terms of immunizations, but pediatric care goes way beyond just immunizations.
Wow. That's amazing work. Now, speaking of mental health services, I know that there's medical, it began as medical services, right? But now it's expanded to more mental health services as well. Would you say that that's also a need and a service that the organization provides at this time?
Yeah, it's a huge need. There's a huge lack of mental health services in Calgary, and there is a lack of uh, professionals. And our challenge is how to integrate our mental health members and colleagues into the healthcare system in Cabo Verde, and how to effectively use them to help meet some of those unmet needs that exist there. And so that's still a challenge.
Mhm.
Surgery sometimes is easier because you find a tumor, you cut it out, and then you come back and find another tumor and cut it out. Mental health requires often a more longitudinal approach to care and the relationship building with patients. Uh, and so it's a little bit different in terms of the approach, but here in the United States, telemedicine is being used extensively in mental health.
Mhm.
So our ability to harness that kind of approach maybe a way to meet some of those needs that exist right now in Cape Verde with some of our members in the United States, be able to collaborate with them.
Right, and provide those services, yeah. Um, what is your vision moving forward with the organization? What's your ideal vision? How big do you expect it to grow? And what's in the works?
So we're very excited about some of the next steps. There's a lot of things here going on, but I've been going to Cabo Verde even prior to COVID. I've been going for the last 20 years, trying to teach minimally invasive surgery and bringing equipment, trying to have an impact on the healthcare system in terms of the delivery of surgical care. Uh, because medicine and surgery is evolving. We have so much more advanced approaches to treatment of surgical disease, and in Calgary, our population is often don't have access to these new technologies. So since 2000 and 2003, I've been going to Cabo Verde on a regular basis, and so I have established relationships there for over the last 20 years and trying to train doctors. I mean, that's been a very frustrating thing for me because I train, I bring equipment, and then when I leave, they stop doing it. And
Mm,
then I go back and then I retrain. Some of the people I train already retired, and new people that come in, I train them again, and then I leave and they stop doing it. So that frustration for me
mm,
led to a lot of conversations and the discussion has been about the need for us to have actual uh, postgraduate residency training programs
mm,
that train. So instead of working with doctors that already have pre-established habits and have been trained before and are hard to change, how to teach the old dogs new tricks, right?
mm.
So if we started with young doctors and train them from the very beginning, this is the only way they know how to do it,
Yeah.
then we can have a new generation of physicians that bring in a different level of care. And so the idea has been in the back of my mind for like several years now is the idea of starting residency training programs to train doctors who specialize in specific fields in Cabo Verde so they could stay there.
Hmm.
And so how do we start a school of postgraduate medical education in Cabo Verde? And that's what really is our next goal. And
Wow.
we are planning to this fall to really start training programs in surgery, anesthesia, in internal medicine, obstetrics and gynecology, to have those training programs that we're going to be an integral part of. Because a lot of our members are people who are extremely talented
Yeah.
and they have an enormous amount of experience in medical education. Most of them are in academic medicine, major medical centers, academic medical centers, from Harvard to Yale to Brown to Duke, and these are people who have enormous experience in medical education. So we're
Wow.
going to take those skills, how to train doctors,
Yeah.
and bring those skills and talents to Cabo Verde and begin to build education programs for graduate medical education in Cabo Verde so that we can meet some of those needs in a more sustainable way and not depend on when we go once a year or when uh, depend on the importation of Cuban doctors and so on, but to have a sustainable approach to meet healthcare human resource needs.
Uncovered. Amazing, amazing. So if I were a doctor or someone in the mental health field looking to join the organization, how would I go about doing that? Or what are the criterias that you're looking for?
So we are open to everyone. So we have members who are nurses, who are doctors, who are psychologists, who are social workers. So our site is quite open. To join it, it's easy to go on our website, and there's an application process for membership.
Mhm.
And so it's very straightforward. Uh, and The opportunities to collaborate are enormous. We have a whole mental health committee that meets almost on a weekly basis. They're very active. There's a number of opportunities to participate, uh, both in mental health, nursing, in surgery, in other fields, primary care. So the opportunities are in everywhere. And again, the idea is not just in Cabo Verde, but in our communities here. We have a community affairs committee that's also very active. We run a free clinic in Pawtucket where we provide free healthcare to members of our community. We offer scholarships for students who are interested in healthcare careers.
Mhm.
So we are doing research programs at Beth Israel Medical Center where we're studying healthcare behaviors in our population who seek healthcare at Beth Israel and Boston Medical Center. So there's a lot going on, and
There
I just
is, and
had no
it's
idea how it's
wow.
all happened. But there's so much talent in our community, and
Yes.
people come up with great ideas all the time. And my job is to really give them the energy to run with it.
Yeah, that's amazing. And what is the website that we can apply and join?
So the website is cvams.org. So it's easy. It's just CVAMS,
Mm-hmm.
Cape Verdean American Medical Society.
.org.
.org. Yeah.
Yep. And then,
And there you'll find a lot of information about our committees, our activities. We have our annual meeting where we talk about our strategic planning for the coming year. It will take place in October of 2025. It'll be our fifth year and anniversary, and then there's a lot of discussion, but certainly we are going to focus on the idea of decolonizing health, global health in Cabo Verde.
yeah,
Um,
yeah,
and that's part of this whole initiative of graduate medical education, training our own doctors, taking all those talents and resources we have here to train doctors in Cabo Verde and begin to decolonize healthcare there. So that's
amazing work. When is the next trip coming up to Cabo Verde? Do you have a set date?
yeah, we're gonna be there in the first week of August. We have cardiology. We are at this moment doing a huge study in Cabo Verde looking at the incidence of rheumatic heart disease in children in Cabo Verde.
Mm-hmm.
So we have this huge collaboration with Harvard Medical School looking at that, and we're screening kids throughout Cabo Verde for the incidence of rheumatic heart disease. So there's going to be a team there in August. We have an orthopedic team going in August as well.
Wow.
And we have this constant collaboration where we run a tumor board on a bi-weekly basis where we have meetings where the doctors in Cabo Verde present cancer cases and we discuss them together and develop plans of care. Some of those patients are patients that are scheduled for surgery, and then some of them begin chemotherapy now, and when we arrive in August we'll be doing surgery, and then we'll have another team in November, and then yes, I have a regular schedule. We have teams there to
Wow.
help support some of the more complex surgical cases they have.
Wow. Amazing. Wow. So, Dr. Texeira, I just want to say thank you so much for everything that you're doing for our communities. And yeah, it's true. It's been truly a pleasure to do this first interview with and the with this for also first movement with this podcast. So I feel honored. Thank you so much for your time. We are looking so forward to expanding this and sharing more stories and knowledge and growing even bigger. You're doing an amazing job. Thank you. Thank you again. And next episode will be with Dr. Maritza Barros, and she will be speaking on women's health. Please tune into that. And again, doctor, thank you so much for your time. Continue the good work. We appreciate all that you are doing. Do you have any last words for our listeners? Anything that you want them to know about you or about the organization before we take off?
No, just that we're open community, a very very welcoming community. Everyone is welcome. We look forward to your contribution. There's another thing that's important is that fundraising is important for us. And in our website, you have opportunity to contribute from a fundraising point of view. You can donate. There's a donate button in our website where you can donate like, any amount that you feel comfortable with. And if you think that you can only give a few dollars a month, you have that option to just also make it like a monthly contribution where you can just give $5 or $4 a month. All that is welcome because it helps us to meet the goals of equipment, transport,
Yeah.
all kinds of logistical expenses that we have to make some of the trips and the equipment that we bring and shipping and flying materials there, which is quite expensive. We
All
appreciate
right.
your contribution.
Yeah, again, the CVAMS.org. Please do go and check it out and make your donations if you are feel called to do so. Again, thank you so much, everyone, for tuning in. Until the next episode, be well.
Take care.
Take care.